Hi guys, my name is Coraine Dimple si Pagunuran from N3A and I am now reporting Pertussis. Kindly watch my video. Pertussis. First, I would like to show you the contents of my report. We have what is it, incidence, signs and symptoms, mode of transmission, diagnostic procedure, complication, treatments, and nurses' responsibilities. For what is it? Pertussis is also known as whooping cough. It is highly contagious respiratory disease. It is caused by the bacterium Bordetella pertussis. Pertussis is known for uncontrollable violent coughing, which often makes it hard to breathe. After cough fits, someone with pertussis often needs to take deep breaths, which result in a whooping sound. Pertussis can affect all ages, but it can be very serious, even deadly, for babies less than a year old. The earliest clear account of whooping cough was described in 1640 by Baylow, an epidemiologist. The name pertussis means violent cough and was first used to describe the disease in 1679. In China, the disease is known as 100-day cough. For the incidence, the annual worldwide incidence of pertussis is estimated to be 48.5 million cases, with mortality rate of nearly 295,000 deaths per year. In 2018, the World Health Organization reported 151,074 pertussis cases globally. Based on 2008 data, WHO estimated that there were 89,000 deaths because of pertussis. The reported cases of pertussis in the Philippines from year 2008 up to 2020 has a total of 743. Pertussis disease rates are highest among young children in countries where vaccination coverage is low. For the signs and symptoms, pertussis can cause serious illness in baby, children, teens, and adults. Symptoms of pertussis usually develop within 5 to 10 days after you are exposed. Sometimes pertussis symptoms do not develop for as long as 3 weeks. We have two stages to show the signs and symptoms of this disease. First is the early stage. During 1 to 2 weeks, we have runny nose, low-grade fever, mild and occasional cough, apnea in baby, or the pause in breathing. And for the later stage, after 1 to 2 weeks, paroxysms or fits of many, rapid coughs, followed by high-pitched whoop sound. Next, vomiting, exhaustion, and cyanosis. For the mode of transmission, pertussis is spread through respiratory droplets from person to person. It is a disease only found in humans. People with pertussis usually spread the disease to another person by coughing, sneezing, talking, or when spending a lot of time near one another, where you share one breathing space. Many babies who get pertussis are infected by older caregivers or guardians by kissing them who might not even know they have the disease already. For preventive measures, we have the preventive equipments wherein we can use such as disposables, masks, alcohol, and disinfectant to protect ourselves from getting this disease. Second is the proper hygiene. Practicing and promoting good hygiene, including proper daily hand washing, covering your mouth and nose when sneezing and coughing, and proper waste disposal may help us prevent getting infected of this disease. Third is the antibiotic. If one of the member of your household has been diagnosed with pertussis, the local health department or your physician may recommend preventive antibiotics for other members of the household to help prevent the spread of the disease. Last but not the least, vaccines. Getting vaccinated is the best way to prevent pertussis. Among babies, children, teens, and pregnant, and also in adults, we have this different vaccine to prevent pertussis. One is DTaP, it is for young children, and Tdap for preteens, pregnant, and adults. For the diagnostic procedure, there's a lot of diagnostic procedure in assessing and confirming the pertussis disease, but I only choose three of them. First, nose and throat culture test. The physician takes a swab or suction sample from the area where the nasopharynx located. The sample is then checked for the presence of whooping cough bacteria or the Bordetella pertussis. For blood tests, a blood sample may be drawn and sent to laboratory to check white blood cell count. A high white blood cell count typically indicates the presence of infection or inflammation that can be result of pertussis disease. Lastly, the chest x-ray. The physician may order an x-ray to check for the presence of inflammation or fluid in the lungs, which can occur when pneumonia complicates whooping cough and other respiratory infections. For the complications, pertussis can cause serious and sometimes deadly complications in babies and young children, especially those who have not received all recommended pertussis vaccines. In baby, complications are brain damage, pneumonia, seizure, bleeding in the brain, apnea, convulsions, and deaths. While teen and adults can also get complications from pertussis, they are usually less serious in this older age group, especially in those who have been vaccinated with pertussis vaccine. In adults shows sleeping difficulties, urinary incontinence, pneumonia, and rib fracture. For treatment of pertussis, it is easily available and highly encouraged. If started early, it can help reduce severity, duration, and the risk of complications. So once a diagnosis is made or suspected, exposure has been determined, you should start on antibiotics immediately. Several antibiotics or antimicrobial are available to treat pertussis. The most popular are azithromycin, clarithromycin, erythromycin, and trimethoprim sulfamethoxazole. For the nurse's responsibility, we have monitor patient's condition to assess the severity of the patient's disease and to plan for good intervention. Next, educate about proper coughing and breathing techniques for the patient to ease the uncomfortable feeling when coughing and for them to know how the easiest way to inhale oxygen and exhale it without gasping. Third is promote effective coughing. Educate the patient about optimal positioning or the sitting position, use of pillar or hand splints when coughing, use of abdominal muscle for more forceful cough. Fourth is educate about proper positioning. Position the patient upright if it is tolerable. Regularly check the patient position to prevent sliding down in bed. Next is encourage increase in oral fluid intake. It is also to ease the patient's feeling of uncomfortability and increase in fluid intake. Also prevents dehydration from vomiting causes of violent coughing. And last but not the least is administer medication as prescribed. Give medication as prescribed after consideration of the potential adverse effect, tolerability, and last is adherence to the regimen prescribed. These are the references that I use. Thanks for listening.